Good morning, everyone. My name is Ben Sims. I'm Chief Exec of THET, the Tropical Health and Education Trust, and I'm delighted that you've been able to join us today. Thank you so much. I'm going to be handing over the reins shortly to Jemima, who is a trustee of THET and a distinguished midwife in her own right. But it's my pleasure to be able to welcome you and to introduce Dr. Navina Evans, who is the Chief Exec of Health Education England. In terms of the welcome to the conference, we're hoping that we'll have at least 200 delegates. We're very excited that we have people from 25 speakers from North America, from Europe, from Africa, from Asia. It's a truly international conference, and it reflects the magnificent expressions of solidarity that health workers have made to each other during this incredibly challenging and difficult time. I would like to thank our conference sponsors, Health Education England, Healthcare UK, Health Services Executive Ireland, Bill and Melinda Gates Foundation, the Catholic Health Association of the United States, NHS Scotland, Global Citizenship Programme, and ACHEST. Um, I'm absolutely thrilled that Navina Evans has agreed to give the opening keynote. Navina has long championed the benefit of global health for the National Health Service in England as a chief exec of an NHS trust and now as chief exec of Health Education England. Um, we admire her, we learn from her, and we are very grateful to you, Navina, that you're opening this conference. Thank you.
Thank you so much, Ben, for your very kind words. Um, I'm hugely grateful to be given this opportunity to say a few words at the start of this really important conference focused on health partnerships and COVID. So my name is Navina. I'm Chief Executive Health Education England. I'm also a clinician, a child and adolescent psychiatrist by background, and I've known Ben and colleagues from THET for quite some time in my previous role in a provider trust in England. THET has for many years now been a key partner in Health Education England's global health work and a crucial and I'd say constructively critical friend. And we are really proud at HEE to co-sponsor this event. This conference is a really good chance and opportunity for us to be amongst colleagues, reflect on what has gone well over the last 3 years and where we could focus our efforts going forward. I think the pandemic has brought out the best in many of us. It's also brought out some quite painful revelations, and we've had to be confronted with some quite difficult truths. But let's stick with the positives. The health partnership movement is so important. It's important to me personally, and as we think about the next 3 years and beyond, I believe that health partnerships need to be central to how we approach healthcare of the future. As a clinician and a chief executive of a trust, and now have the opportunity to be CEO at Health Education England, I've always worked on the assumption that all health is global health. It kind of seems obvious to me. And knowing that we must think globally, always, even when we act locally. And I think COVID-19 has really brought that to bear. And I suspect that most attendees today, also you've known this for a while, all health is global health. Our health systems are interconnected and interdependent. They have been for a long time. They've become more so over the last 3 years, and there is no turning back from that. So to start this event, I'd like to stay positive, think about what has gone well over the last 3 years, and what should we keep from this period as we begin to think about the future and how we move forward from COVID. I suspect that there are three things we should focus on. Institutions which enable partnerships, technology which enable improvement, and most importantly, how we support grassroots enthusiasm of health workers all around the world. So let's start by thinking about health workers ourselves to start with. This enthusiasm that we have seen in this last few years and the wonderful small and big stories of genuine solidarity has become, I think, a defining trend of the pandemic. Not just about people going above and beyond and for longer than we could imagine in caring for patients and looking after communities in our own system, but also in the international collaborations to support people all around the world. Now, when that surveyed health workers last year, I believe that a small minority, something like 1%, said that they didn't feel engagement in global health work would have been a benefit. Seems a bit curious. And a few said that they needed more encouragement to do this. But most of us got how important this is. And also, most of us feel that we need more information, more support, more connectedness, more funding, thinking about global health as a whole. Enthusiasm and goodwill from health workers, for me, is the critical ingredient that we need as we think about the next stage of how we confront the recovery of COVID, how we think about global health security. But it's not the only one, which brings me to the second point: institutions, organizations, systems. Now, there is a great deal of enthusiasm for health partnership working. So we must ensure that its demand is led and it has good collaboration. And I think our institutions and organizations have a key role to play in setting this example. I haven't got time to go through. There are lots of great examples. I'd pick one, the Myanmar UK Healthcare Alliance. Perhaps you could find out a little bit more. Now, the THET report, experts in our midst from last year, highlighted how individuals and groups play a pivotal role in global health work, and also how important these partnerships are. And there's lots of experience and learning that we can share with one another, and I hope we do that today and beyond. Finally, I want to just touch on technology. It's been amazing, hasn't it? A huge enabler for all our work in these last few years. Keeping the focus on the Myanmar work, technology has played a huge role in enabling those health partnerships. And we've been really proud to work with THET, piloting digital fellowship models which support NHS workers to collaborate with their peers. There's been lots of platforms such as Pulse and the THET Innovation Platform, which have been huge enablers of peer-to-peer, institution-to-institution collaboration. Who would have thought 3 years before COVID, Zoom, Microsoft Teams, it would have been hard to imagine how we could all be, how all these international partners could be connected if we've never met in person. So technology, digital by default approach, not only has sustained partnership working during the pandemic, but also allowed for greater engagement within the NHS that we've seen to be better at being more equitable, to really challenge the stark truths of health inequalities. And also, we know that people who might not have been able to travel can engage in this amazing work. It's also got a huge contribution in lower carbon and planetary health, and is the single largest public health challenge of our time. So that is what we need to keep: technology, what we need to build on and improve, institutions, what we need to harness, the enthusiasm of health workers, always coming back to that one. So it's really important to think now. We hear these odd kind of clunky phrases such as living with COVID and moving to recovery. I don't think they really capture the moment that we're in. So working with colleagues on the front line, I know that phrases like that don't really represent reality. And I know that across the globe, colleagues in low and middle income countries are also concerned. Things may be feeling much worse. We're not out of the kind of worst of it yet. So in HEE, we ask ourselves, what can we do? And our global health strategy focuses on harnessing the power of partnership. I cannot stress that enough. And on harnessing the power of mutual learning to strengthen what we do in the NHS, but also to support us in the NHS to play our part in building strong, sustainable and equitable health systems beyond our own country. Partnership represents solidarity and cooperation on common global challenges from the front line to the World Health Assembly. And we need to focus on issues such as going forward, such as pandemic preparedness, climate change, shared and growing health workforce crisis. You know, there's so much more to be done. And it's genuine partnerships that we will all benefit from. And the whole that we all have to bring to this agenda has the potential to be so much greater than the sum of the parts when all of our priorities, activities, and our initiatives can be aligned. So we have identified key stakeholder groups which HEE will seek to benefit through our health partnerships. And they are individual health workers in the NHS. The second group are NHS providers and integrated care systems. We're working that is how we're going to be looking at health and care going forward in England. And thirdly, and importantly, our global health partners. So all of our work in Health Education England will be focused on developing new partnerships which will bring benefit to all these three groups. So given that context, I would like to leave you with 5 questions which I believe that we should all be asking ourselves, whether we're planning global partnerships or whether we're thinking about local service change. Number 1, how does whatever we're doing improve global health security and support COVID recovery? Number 2, how does whatever we're doing improve and develop the skills that will be required for the future workforce? Number 3, how does whatever we're doing strengthen the understanding of diversity, inclusion, and belonging, critical factors for working in health and care? Number 4, how does whatever we're doing, planning, improve the ability of our local systems, wherever we are, to deliver the best quality care and that people that we serve absolutely deserve and have a right to? And finally, how can we make sure that whatever we're doing enables a workforce to make a greater contribution to sustainability and countering the effects of climate change? In healthcare, it is our problem as much as it is anybody else's. I'm coming to the end of my time. I want to thank you once again, everybody, for being part of this wonderful movement. And I said before, we started something really special and there's no turning back. We can only go forward. Thank you.
Terribly grateful to Dr. Navina Evans for opening this session, and Jemima Dennis Antwi will be joining us to chair in a moment. But it is, and offer some sort of general thoughts about the conference and what we're going to achieve today. But it's my great pleasure to now turn to Dr. Rudy Eggers, who is the Director of Integrated Health Services at the World Health Organization. FET has the great privilege of being an NGO in official relations with Dr. Eggers' team. And Shan Syed will be joining us to take part in several sessions. Rudy, thank you very much for joining us and agreeing to give, if you like, the global perspective, which will complement the perspective that Navina has given. Thank you.
Yes, thank you very much for getting us started, for the kind introduction. I'm wondering if you are going to pull up the slides or should I share them from my side? There we go. If you could make it a full screen, please. So yes, thank you very much for this opportunity. Let me briefly introduce myself. I'm Rudy Eggers. I joined the WHO headquarters team approximately 6 months ago as the Director of Integrated Health Services. During the first 2 years of the pandemic, I was actually the WHO representative in Kenya, and as such, I was very closely involved in making partnerships work under the pressure of the pandemic in the country setting. So thank you very much to our THET colleagues for organizing this timely and important event that brings together the partnership community who have done so much to serve the people throughout the collective pain of this pandemic in the spirit of solidarity across the world. WHO has over the years been closely connected with THET, and many of you will know the work that we have done with THET on twinning partnerships for improvement. Moving forward, I appreciate this opportunity to be able to share some thoughts with you this morning on the pathways towards COVID recovery and the role of institutional health partnerships. Just requesting that the slides go full screen. There we go. Wonderful. Okay. With the second slide, given the state of the pandemic, can we really speak about recovery at this time? Let's reflect back to when we convened the THET conference in a time of COVID back in March 2021. At that stage, we had just over 120 million confirmed cases globally. We had seen about 2.6 million confirmed deaths, about 500,000 new cases every day, and just over 363 million vaccine doses had been administered. That's the top map there. Today, as we reconvene, just over a year later, we've seen over 500 million confirmed cases, and that's probably an undercount. Over 6 million cumulative deaths, and we continue to see 400,000 confirmed cases every day, definitely an undercount. Importantly, a total of over 11 billion vaccine doses have now been administered. And of course, this is not without the significant equity issues we all know of. Yet, while we are very much in the midst of the pandemic, we need to think forward. We need to think recovery, even while we continue the public health response to this pandemic. I would like to share with you today 5 points of emphasis from our perspective as you think through the work of partnership on the pathway to recovery. Next slide, please. First, let us be sure to continue to tilt institutional partnerships to adapt to the evolving COVID context. What do I mean by that? We must acknowledge that partnerships have had to show extraordinary flexibility in their work through the pandemic and were helped by the technology, as was mentioned just earlier. This better way of working will need to continue as we move from a focus on maintaining essential health services during the pandemic to a focus on optimizing health services as they continue to take account of the pressures that we've placed upon them, particularly the health workers at the point of care. This requires partnerships to take on practical issues and areas of work that are considered priorities, even within the messy realities of health service delivery. For example, how can infection prevention and control, that central priority during the pandemic, be taken forward through tilting partnerships work accordingly? We believe the WHO approach to twinning partnerships can continue to be used for this purpose. Next slide. Second, I urge us to remember to focus on quality issues through the work in your partnerships. Our Director General, Dr. Tedros, has been very clear in asserting that quality is not a given, and it can never be taken for granted. It takes vision, planning, investment, compassion, meticulous execution, and rigorous monitoring from the national level to the smallest, remotest clinic. This principle can manifest itself through the work of partnerships, which often focused on improving quality of care. This focus on quality of care and services can be a fundamental and common platform that the partnership community can use to drive forward positive change across the world. Again, WHO has a range of technical resources on quality of care that can be used in your partnership. Next slide, please. Third, I would like to ask us all to carefully consider the primary healthcare approach that will be pivotal in the post-COVID world. As many of you well know, the WHO UNICEF PHC operational framework provides a clear pathway towards UHC and the health-related SDGs that countries across the world have highlighted as central to their future. The set of interdependent strategies and strategic and operational levers provides a clear pathway that countries will need to adapt for their own setting. In addition, the recently released Primary Healthcare Measurement Framework and Indicator document provides a mechanism for countries to track, monitor, and improve PHC performance. We encourage all partners operating in this space to contribute to and support primary healthcare approach and its measurement. Next slide, please. On my fourth point, the heart of partnership movement, compassion, should remain central and to be understood to be the glue that binds together those that are working together in partnership. The compassion equation of awareness, empathy, and action can be applied to multiple levels, from the lowest point of care all the way to the global level. The compassion that is often shown between health workers participating in partnership across countries and cultures is truly remarkable, and this can be a continued significant driver of transformative action by change makers in various settings. Let us remember the power that compassion yields, particularly in a changing and challenging world that we are living in. Next slide, please. Finally, let us keep an unrelenting focus on learning with humility as we continue our partnership working with intensity. Many of you will have seen the collation of learning on the role of institutional health partnerships that have been captured in the WHO COVID-19 Health Services Learning Hub. This can be built on to ensure that we capture learning that emerges from the application of partnership approach as we hopefully emerge from the pandemic soon. This emphasis on learning has the potential to shape the partnership of the future. Next slide. I thank you again for this opportunity to share with you some thoughts from WHO as you all start the proceedings of this conference. Of course, I look very much forward to learning from the proceedings of today. Thank you so much. Back to you.
Hello. Thank you very much, Dr. Rudy Edgars, for your very insightful thoughts this morning and for these powerful 5 points of emphasis towards recovery, which are very helpful for strategic planning as we move towards recovery. Among the 5, I'm very passionate about the quality of care, the compassion equation, and also learning with humility, and also acting with intensity. These are very helpful, and I believe that as health workers moving forward, we'll be able to address these issues. Thank you very much again for these insights. Dear distinguished personalities, keynote speakers, trustees of Tropical Health Education Trust, staff and delegates. My name is Dr. Jemima Araba Denisentry. As Ben initially indicated, I am a trustee of THET, and by background, I am a multi-skilled Ghanaian midwife and nurse leader, a health promotion and communication expert with over 33 years cumulative experience locally and globally, having managed collaborative projects and programs through public service, development work, and independent consultancies in maternal, newborn health, midwifery, nursing, and health system strengthening. Currently, I work as the president and CEO of Center for Health Development and Research, a Ghanaian-based international nonprofit organization. On behalf of THET, I say thanks to the organizing team for making today happen. I welcome you all to this global interaction with over 200 expected delegates, 25 speakers, cutting across North America, Europe, Africa, and Asia. We thank you all for joining this exciting conference to deliberate on the theme, COVID Partnerships, Transformative Pathways for a Healthy Recovery. I am indeed delighted to chair this opening session and to give a few remarks. You would all agree with me that COVID-19 has been a global scourge with diverse health, negative health, social, and economic impacts in countries, communities, and families. Employees, especially health professionals, and their partners have learned much and generated evidence and mobilized resources that have facilitated the attainment of current improvements in curtailing the spread of the disease, even though there is still much to be learned. In particular, society and global leaders need to act on what we already know and to take appropriate decisions to mitigate the harmful effects and inequalities aggravated on regional, national, and global levels. Global partnerships such as THET, COVID partnerships, are therefore key to such success. As THET, today, 22nd April, marks our third and final COVID partnership conference aimed at exploring the conditions driving the pandemic and shaping the collective responses that we have. Equity, quality, and workforce form central themes which would inform the interactive panels that we are going to be experiencing today. We will have roundtable discussions and also keynotes that have already started. Based on the outcomes of these discussions, we will expect delegates to develop the next steps for greater impact and preventing another scourge. We still have a lot of work on our hands as health professionals, and indeed, THET is excited for the existing partnerships with Health Education England, Healthcare UK, Health Service Executive Ireland, the Bill and Melinda Gates Foundation, the Catholic Association, the Catholic Health Association of the United States, the NHS Scotland Global Citizenship Program, and HEST. This conference provides a virtuous international stage for appreciating you, our partners. We want you to know that we hold you dear for this vital cooperation, and we are so grateful. Thank you so much. Dear delegates, as you may have checked from the schedule of today's program, overall, we have 7 informative sessions that have been put together for you between now and 15:30 BST. This includes the first session which we have started, looking at falling forwards and learning from our mistakes. We would also look at the story of Somaliland, that is the Hagiza General Hospital. We would look at the session on prescription for pandemic with focus on delivering quality UHC. We would look at adaptation and innovation. We will look at bridging the solidarity gap, and then also a session on roadmap for recovery. And then we'll end the entire day with an ending keynote and then closing remarks. I am indeed optimistic that you will stay on to actively participate in this session. For you, to effectively benefit from the conference, kindly take note of the following. Each session will be recorded and made available on the THET conference platform, so you can access this. We invite you all to also join the conversation on Twitter by using the hashtag COVID Partnerships. Delegates, you are also invited to the chat function in Airmeet, and you see it on the right-hand side of the screen. Please add your comments and questions accordingly. Should any delegate experience any internet connectivity, try to use the low bandwidth option and the audio only mode so that at least you can hear the sessions. In the end, we'll be producing a learning document from this conference to provide an important record of how health partnerships have responded to the challenges of the pandemic. And this will be in tandem with the learning papers from 2020 and 2021 conferences. Now we're going to start our Falling Forwards session. That is the first session. Our keynote speakers already, we have had two who have presented. You have a maximum of 10 minutes each for our global community. And also we have I would like to introduce our speakers who are yet to present. I would like to first of all comment that Dr. Nevina Evans, who presented first, would have to leave us, and therefore she's being replaced with Tom, and I will introduce Tom when the time is due. We've also had Dr. Rudolph Eggers, who has presented, giving us insights around recovery and the strategic actions to take. And finally, we are going to have a conversation between Gila Zabiv of Israeli Midwives Association and Sana Gul Balok from Aga Khan Health Services in Pakistan. Let me briefly introduce our wonderful two. By background, Gila Zabiv is a certified nurse midwife with a master's in women's health, and she's currently a PhD candidate. She's also the head midwife for infectious disease prevention for the labor and delivery ward. It's noteworthy that Gila delivered the first COVID-19 positive birth in her country, and since then has been given the responsibility for leading COVID-19 management protocols and implementation. Thank you, Gila, for that. I also want to introduce Sana Good Bolok, who is a community health nurse working with Aga Khan Health Services, Pakistan. Sana has done tremendously well as a community health nurse working in Pakistan, working to provide services in health prevention and promotion in remote and urban communities in Pakistan through health screening, vaccination, immunization, and also dental check. I would like to indicate that when you can put in your questions in the chat box so that after the discussions, we can look at your comments and have a wonderful discussion. Thank you very much. I hand over to Sana and also Gila. Thank you.
Thank you so much, Dr. Jamima, and thank you for inviting us today here in this platform. It's a great pleasure to be here with Gila. How are you, Gila? It's amazing to see you today.
It is so good to be here. It is an honor and a pleasure to be here to see you again. Thank you so, so much, Thet, for having both of us.
Thank you. I just wanted to know, Gila, what has the last 2 years of the pandemic been like for you and for your colleagues in Israel?
So I think that all of us globally and in Israel have been experiencing relatively the same thing. In Israel, we have a unique combination of high birth rate and a high COVID rate. So we early on, pretty early in March, I delivered the very first baby in the country, and from then we had the pandemic hit our shores like it hit everywhere else. Speaking on a platform such as THET, we clearly learned the importance of being involved in all the research, being involved in the new information coming out from the WHO. For example, in May, as soon as the WHO set out the standard that we didn't have to separate mothers and babies, we immediately stopped that very day. So I think we are experiencing the need to adapt, to innovate, to manage like the rest of the country and thus the world. And it was incredibly challenging, but we learned a tremendous amount about our capabilities and our innovative abilities during this challenging time. You and I both, Sana, have the honor to be a part of the Nursing Now Challenge. So, how do you feel that this has helped us, nurses and midwives, during the pandemic and the COVID-19?
Yes, Nursing Now, I think Nursing Now was launched even before pandemic. It was launched in 2019 since I'm part of it. Now it was Nightingale Challenge, Nursing Now Global Campaign. Then in June 2021, it transformed to Nursing Now Challenge. But to be honest, I think, Gila, you would definitely agree on this. Nursing Now was able to make this ripple effect on the ocean for enhancing the visibility of the nurses and midwives globally and like in international platforms and local platforms. There are so many things that Nursing Now Challenge has been doing. That includes global solution initiatives, which is nurse or midwives led initiatives, like they can pitch in an idea with collaboration with any other healthcare organization or any other NGO, and they fund and support them to create that idea into reality. This is something that nurses and midwives who rarely has been given chances to pitch in their ideas or change them into realities. I would definitely give credit to Nursing Now for this amazing initiatives. And under this campaign, there are leadership development courses for early career nurses and midwives. And I have been part of so many. One of them I can certainly recall was about the community mobilization courses, immunization advocacy courses, and other leadership courses such as Health Training UK. And recently, I had an honor to be part of Harvard launch of leadership courses for nurses and midwives that was done in collaboration with Nursing Now. I think this was something really important to bring in front of the world that what nurses and midwives do every day and what they are capable of. Campaign like Nursing Now made it visible internationally that nurses, if given proper capacity building opportunities, are able to influence the global health. And I think the conferences such like this we are part of, and coordination with other colleagues internationally and globally is one of the another best of things that I got from Nursing Now. Just linking this same scenario with another question, Gila, to you about the having the visibility and interacting in international platforms. What value do you place on being able to talk to colleagues internationally as well as locally? Does that international lens give you insight that you might not otherwise have, or is it something else that you gain from this exposure?
Well, first of all, your answer is amazing. I agree with every word that you said, and it's 100% true. A lot of terrible things came out of COVID-19, but a lot of beautiful things came out as well. For example, platforms such as these, THET, the Nursing Now, Midwives in Focus, the ability for us to collaborate and cooperate across oceans is something that we have never ever had the opportunity to before. And I can tell you that throughout, while I was developing and creating new protocol, I was in touch with people overseas. How are you managing? What are you doing? We're talking concepts like esoteric things, like midwives who are struggling and going through a difficult time, and having sessions that we had on a global level. We had support sessions for midwives who are struggling with the COVID-19 pandemic from America all the way to Israel and beyond those things in terms of practical. How are you managing? How are you not separating babies? Where are you getting your equipment from? It opened doors and opened communication of collaboration and cooperation that never existed before this day on a level that I'm familiar with. I also think that experiences such as the Nursing Now and THET and the WHO allowed midwives a platform and a voice with regards to research and leadership and education that they weren't uh, able to have up until this point. And if we were to have um, a, a conclusion of that, it would be that we need to continue in this way. We need to continue. So this is the third and final conference that's organized by THET, which is focused on COVID. And we've heard from the WHO, and we know that many national governments are represented here, including donors, etc. So from the perspective of nurses and midwives, what are the most important things that you think our international audience can do as we emerge from this pandemic?
I think this is a very important question. Since the campaign for nurses and midwives was before pandemic, but pandemic was a factor that not only created challenges but also gave a focused view of the world, organizations, and healthcare professionals, even the global population, on nurses and midwives and how they were in the front line. So this thing should even continue. This appreciation and opportunities and recognition needs to be continued, because now the world should know that the nurses and midwives are the backbone of healthcare workers, and without them, there is nothing. There is nothing in healthcare, literally. So from the perspective of this conference, we are in with the audiences from different organizations. I would request all of them to listen to nurses, to listen to the nurses and midwives working in your organizations. Give them a space to talk, give them a space to share their ideas, value their ideas, value their feedbacks, because they are the ones in the direct contact with the patient. They are the direct healthcare providers. 80% of the direct patient care is given by nurses. That is in the report of International Council of Nurses. So listen to them and create opportunities for them. Revise your policy, revisit your policies that are not flexible enough to give them space for career development, which are not flexible enough to give them space to study more, to enhance their research. Give them a ladder in their backside, how to develop their skills and go beyond the traditional roles. Give them opportunities to go into public and community health as well, from direct backsides. So and of course the technology, the use of technology and tools, provide them with these tools, engage them in these decision making tables. Either it would be nursing informatics, data sciences, artificial intelligence, or public health research, or bedside. So nurses are capable of doing it all. So I would request all the leaders to increase the visibility of the nurses in the table, and give their voices some value.
I cannot agree with you more. And I think that we can conclude by saying that this pandemic taught us, and I always say this, that in front of every birthing woman was a midwife. In front of every birthing woman was a nurse. In front of every patient in the ICU was a nurse. And I understand the importance of working collaborating with physicians and nurses, across the board, but we need more nurses and midwives in government. We need more nurses and midwives in policy. We need more nurses and midwives in research. I had the distinct honor to be one of the first people to publish that the vaccine that went through a team, not by myself, through a team, that the vaccine was transferred to the fetus, and the fetus was covered by COVID-19. This is research that we need to do collaboratively. So I think that in conclusion,
Thank
these
you.
platforms, thank you, Thet, for having us.
Thank
And
you.
Thank you.
Thank
we're
you.
very
Thank you.
That
grateful.
was wonderful. Thank you very much for this wonderful chat from our able colleagues, nurse midwives, Sana, and then also Gila. These have been wonderful. Unfortunately, I think that we have run out of time, but we have wonderful comments that have come up. I would recommend that our speakers, that is Dr. Edgars and Dr. Evans, and also my two colleagues, thank you so much for your contribution, for the insights into how we can transform and set pathways for health recovery towards a better world devoid of COVID. And even if COVID should come, pathways that we can follow in order that we can move the agenda. I would like to encourage our able speakers to check on the chat box, so that if there are any questions that were directed at you, kindly answer for us, or you can send the information to the organizing team and then they would share it on board. Thank you all so much, and thank you listeners for participating in this wonderful first session. We will encourage you to hold on and also enjoy the forthcoming sessions. Thank you for your time, and thank you all.
Thank you.